Hello guys, welcome back to my channel. How y'all doing? Hope you guys are great. So guys, in today's video we'll be talking about why I am not getting pregnant or why I'm not conceiving. You understand? We're going to look at so many factors that have been a reason why you know women do not conceive or why women do not get pregnant. So that's what we'll be discussing in today's video. So guys, stay tuned and let's dive straight into the video. If you've been trying to conceive, okay, and you're under 35 and you've been having sex consistently for a period of 1 year and you do not conceive, or you are above 35 and you've been having sex consistently for 6 months and you do not conceive, try and see a professional. Okay, there's absolutely something wrong. Try and see a professional or a medical personnel. So first and foremost, we have what we call ovulation disorder. By the way, we know what ovulation is. Ovulation is a phase in the female menstrual cycle which involves the release of a matured egg from the ovary, which takes about the period of 10 to 16 days. After it's being released, it's being transported to the fallopian tube where it is being fertilized by the sperm. So the first factor is ovulation disorder. So this involves, in this ovulation disorder, we have what we call PCOS, polycystic ovary syndrome. We have premature ovarian failure. All these disorder, all these things that I mentioned that are under ovulation, they are all ovulation disorder, and they can prevent the release of an egg. And the egg is the major thing that is involved in what forming a child, because when this egg is being transported to the fallopian tube and the sperm fertilizes it, a child is formed. But when that egg is not released, so what will the sperm fertilize? There will not be anything available for the sperm to fertilize. So polycystic ovary syndrome and premature ovarian failure, this can all be a cause to why a woman will not conceive. The second factor why a woman has been trying to conceive and she's not, we have structural stroke tube issues. We have what we call blocked fallopian tube, and this blocked fallopian tube sometimes result from pelvic inflammatory diseases. When pelvic inflammatory disease is not treated properly, okay, this can result to what? Blocking the fallopian tube. It can result into spreading into all the organs of the reproductive system and thereby causing a damage to it. So pelvic inflammatory disease can be a big problem and can be a major factor in what causing fallopian blockage or blocked tubes. So let's say you have a vaginal infection, bacterial infection or yeast infection. Try as much as you can to treat it immediately. Go to the hospital, see a doctor and treat it, because if you don't, this will continue to spread to the other organs of the reproductive system, both the lower and the upper organ of the reproductive system, and end up causing so many damages. The second one under structural and tube issue is uterine abnormality like fibroid. Okay, when a woman has fibroid, this fibroid takes its position in the uterine tube, especially the fibroid that grows inside the uterus. Okay, it grows inside the uterus, thereby preventing an implantation. Or even when an implantation takes place, it doesn't allow that blastocyst that was implanted to grow, thereby might lead to miscarriage or not even being able to get pregnant because implantation will not even take place. This fibroid thereby covers the whole uterus and prevents implantation in taking place. So this is another second factor why a woman has been trying to conceive and it's not happening, or she's not conceiving. The third factor why a woman has been trying to conceive and it's not happening, or she's not conceiving or getting pregnant, age. Okay, we have age fertility decline, okay, particularly in the late 30s and 40s. So as a woman, as your age increases, like when you begin to, from your late 30s, 40s, the quality and quantity of your egg decreases. So sometimes this can act as the factor why a woman is trying to get pregnant and is not getting pregnant. Okay, and if you can remember in my last topic and talk about egg freezing, okay, here comes again about egg freezing. That is why egg freezing is important, because I talk about that as our age increases, the quantity and quality of our egg decreases. But when you try to do egg freezing like in your 20s, okay, that egg remains fresh and does not decline in quantity and quality. And whenever you're ready to get pregnant, okay, your egg is stored somewhere so you can, retrieve it and do whatever you want with it. This age is a big factor because there's always decline in fertility with age. Okay, so try as much as you can as a lady, like if okay that you still want to like pursue your career, okay, your education, and things about life, you're not ready, freeze your egg, like I said in my last video. And if there's no partner coming around, you understand, like I said, freeze your egg. So there is, this time we already have a lot of technologies that can help women to prevent all this fertility issue. So try as much as you can as a lady. If you're noticing that your age, okay, you're advancing in age and maybe you're not ready or there are no partner, try and freeze your egg. Okay, so age fertility decline is another factor why a woman is trying to conceive and okay, she's not conceiving. The fourth reason why a woman is not conceiving is lifestyle. Okay, there are a lot of women that involve themselves in excess consumption of alcohol, smoking. Okay, this can play a factor in affecting your egg and reducing the quality and quantity of your egg. Okay, you also have high stress. High stress can also stabilize your hormone and cause hormonal imbalance. When your hormone function, it destabilizes your hormone. Okay, it can cause hormonal imbalance, stressing yourself a lot. We also have women who are overweight. Being overweight can also make the receptor site of hormones to be insensitive to the hormone, when the hormone reaches the receptor site, it will not be able to it will not be able to bind to the receptor site, because being overweight can cause the adipose tissue, you understand, can cover the receptor sites for the hormone, like for estrogen and progesterone. And when the estrogen and progesterone reaches their receptor site in the tissues, they will not be able to bind to the receptor site, because adipose tissue have caused insensitivity. Okay, the receptors are no longer sensitive to their hormones. So try as much as you can, if you're trying to conceive, not to be overweight and underweight too. We have unexplained infertility, which is the fifth one. Okay, this can be a reason, okay, of why I'm not conceiving, because it results to about 25% of infertility cases. Okay, it cannot be explained, no cause can be identified. So this unexplained infertility is another reason why you're not conceiving. And the sixth reason why you're not conceiving, we have the male factor. Okay, we also have like your sperm count, the quality and quantity of your sperm, the mobility of your sperm. Okay, this can also be a factor to why you're not conceiving. Okay, for example, if the quality is reduced or the quantity is reduced, okay, this can also affect fertility. It can also affect why you're not getting pregnant. So the quality, the quantity, the mobility of your sperm, okay, this, okay, is very important in determining if you will get pregnant or not. Okay, so try as much as you can to know your sperm counts. Okay, go for cell analysis to be able to know both the quantity, the quality of your sperm and the count, everything. It is very, very important. Okay, these are the 6 reasons that I have put together, okay, to why you are not conceiving. Okay, so there are other factors. There are other factors too to why you're not conceiving. Okay, but today I just talked about the 6 reasons. Okay, and I will be stopping here. There are so many factors which I'll still bring to you. So guys, I'll draw the line here. If there's anything you don't understand, you can drop it in the comment section, and we can actually continue this conversation in the comment section. Thank you guys. Okay, thank you very much for watching my videos, and please, if you come across my video, do not forget to give me a like and a follow. So thank you very much and have yourself a beautiful day. Bye.